So very good afternoon to all the esteemed dignitaries, guests, and attendees present here with us today. On behalf of Nationwide Quality of Care Network, I, Dr. Ashna, welcome you all to the launch event of the first issue of the BMJ Open Quality South Asia edition, where we will be witnessing the live unveiling of the QI stories from the field. We'll begin with the holy chanting of the Saraswati Vandana. Next, we have Dr. Janhavi Nilekani, who is founder and chairperson at Aastrika, a Nilekani Philanthropies initiative. She's a development economist by training and now works in the field of maternal health. She has a background in academic research in environmental and development economics with a particular focus on air pollution. She's an alumna of Harvard, where she completed her PhD in public policy and has done her economics and international studies from Yale. I invite you, ma'am, to talk about using technology to scale up collaborative partnerships for improving maternal and newborn health.
Hi, thank you. Thank you so much. I know the topic I've been given is using technology. That is part of what we do at Aastrika Foundation. But I would like to take this opportunity to talk a little bit broader as well. I will get to the tech part. So just to step back a little, what inspired my passion with QI, right? My pregnancy is what inspired in me such a passion to work on healthcare quality improvement. So when I was pregnant in 2016, I was a PhD student at Harvard at the time. As you said, I was doing my PhD in public policy. And I was very research and evidence oriented. I was actually living in Bangalore at the time because I was running a randomized controlled trial of 1,532 bus drivers across 7 districts of Karnataka, which was the topic of my Harvard dissertation. So, I was into research, I was into evidence, I was fully up to date on what the science had to say about what quality healthcare looked like for childbirth. And for me, and pregnancy was such a shock because I could not find quality healthcare in Bangalore for childbirth anywhere, not even in the most expensive hospitals, it did not exist. Right? I mean, I can tell you a gazillion examples of where the Bangalore hospitals at the time were not, practicing QI or evidence-based medicine or high-quality healthcare, but probably the most stark one was the WHO recommendation about, there should be no routine episiotomy for first-time mothers. I could not find a supportive doctor anywhere in all of Bangalore who agreed with me that first-time mothers should not have a routine episiotomy. And this was despite all the evidences and best practices, right? So the challenge at the time, I mean, it's amazing the work you guys are doing now, all of us are doing, but at least in 2016, I guess, I mean, there wasn't enough QI pressure, right? There wasn't enough pressure for India to focus on improving quality of healthcare. I mean, even in the most expensive hospitals, this really gets to me. It's one thing to have inexpensive poor quality care, but this is actually extremely expensive poor quality care. And something Dr. Meena Raina said earlier in the panel struck me that it's very true. The doctor said, we are giving you quality care. And I was just like, you are really not giving me quality care. So I went to my obstetrician with randomized controlled trials, with systemic guidelines, with all of the WHO recommendations, especially on episiotomies. And she said, and it was a very sincere response. She said, I hear you. I know that's the guideline, but it's different here. All that research was done on white women, and you are Indian. So one reason I'm so excited to be here today, and thank you for inviting me, and it's such a pleasure to see these articles being published, see this journal launch, is that I think it's so critical to have research coming out of India, which is global quality standards of research. The inner researcher, PhD academic in me is delighted to be here, even though these days I don't do too much academic research myself personally. So getting back to my story, so this is what really sparked me into being personally so passionate about improving healthcare and improving QI across India. But for me, it wasn't enough to just do it in one hospital. I mean, POQ is needed, but I wasn't satisfied with doing, launching an NGO or something which worked on this, because I also cared really deeply about how do you solve this challenge at scale. I've been very fortunate to be exposed to people constantly who think about scale. because of my father, Mr. Nilekani, and because of the teams he works with and my mother works with, I was just surrounded at the time by people who were deeply thinking about scale. I was constantly exposed to the tools that were being developed, all the thinking that had been done to really think through how can you take a measure like you have 5 years to roll out Aadhaar to 800 million Indians, and how do you do it? You know, how do you say you're going to affect 200 million school children and actually achieve 100 million school children to the Diksha platform that the government of India now runs? So I was surrounded by people who are thinking very deeply about the concept of Samaj, Sarkar, Bazaar. How can they come together? How can we collectively as a coalition address societal challenges at scale, at the scale that India needs, with speed? We can't let COVID let us give up on the SDG goals. Speed is of the essence. And how can we do it sustainably? It's not enough to say that there's a donor-driven program of QI here, or there's a government is pushing a system there, or like there's this one hospital which is being innovative. All of those things are critical. But to do health systems reform across the board, we need to build coalitions, we need to build partnerships, all the things we've been talking of today. So that's what I was thinking back in November of 2017 when all of this was going on in my head. So when I graduated from Harvard and finished my PhD in public policy, I told my advisors, I'm really sorry, but I just can't go into academia. I have to go and do this. And for that matter, I must say, I also left air pollution behind. I said, no, I have to go and work on public health. So I set up Aastrika Foundation, which is, as you mentioned, a Nilekani philanthropy initiative. It is supported by the philanthropic capital of my parents, Nandan and Rohini. And we really work on progress across the entire health system at scale, right? Scaling of QI in healthcare is what Aastrika Foundation is about. So the topic you asked me was technology. Technology is very much part of that. Like, how do you scale? Technology is a big part of scaling. So one of the things we have already launched and which is currently live is our digital learning platform. It's currently called Aastrika Sphere. We at Aastrika Foundation are the technical partner for NQOCN. So NQOCN has a course on our Aastrika learning management platform about point of care quality improvement. And I want to tell all of you, we as a foundation are hosting all of the costs, and Dr. Datta and his team have already created the content. That course is available. Any of you can go to sphere.aastrika.org and log in and do a QI course. You can give it to anybody. And we have so many other courses there on RMC, on childcare. We're partnering with WHO. We're partnering with, the White Ribbon Alliance, with Fernandez Foundation. So it's a true platform of a learning platform of free for users, up-to-date, best quality content on healthcare quality improvement. And we have more content coming all the time. So please do go there and check it out. That's the part about technology. But I do want to say that digital infrastructure, like the virtual learning platform that we currently are operating, is only a tool to scale. It's one part of it. So when we say Sphere, like a societal platform for healthcare, we mean a lot more. Right now, since we're just young and getting started, the priority has been the virtual learning management system, but we have a lot of other ideas in the pipeline. So digital infrastructure can definitely empower scale, but there are many other things that improve scale. Just simplifying the process of QI improves scale. Globally, turning QI into a toolkit, like what Ariadne Labs has done, or what, the WHO's labor care guide, which is just the most beautiful piece of work to translate the intrapartum guidelines into something which you can implement. Those things are all also infrastructure. They may be process infrastructure, they may be, method infrastructure, but all of that is infrastructure which drives scale. I mean, investing dramatically in point of care QI, like all of you are doing here, is part of scale. Everything that the WHO Academy is putting out about really using adult learning science to improve quality improvement is amazing work. I can go on and on about what every exciting work is happening in quality improvement in healthcare, both in India and globally. So as both Dr. Vikram Datta and Dr. Neena Rana mentioned, and I think more of you, that partnerships and coalitions are just critical here. If we are really looking at health system reform, like systemic reform at scale, with speed, sustainable, embedded change, which is embedded in every ecosystem in India, at least, if not the world, the only way is for all of us to work together to build coalitions and to build partnerships. So I'm delighted to be here. We are so excited to partner with all of you in the upcoming years to really scale up quality improvement. We should be looking back when it's time for the SDG goals and feel that we collectively, as a coalition of committed partners, we succeeded. We should feel like we succeeded at the SDG goals, that we did it. We improved quality of care. I think sometimes one of our slogans is about improving access to 25 million women in 2025 and so forth. And I think many people think it's a slogan for Aastrika Foundation, but it's not a slogan, because Aastrika Foundation is a Nilekani philanthropies initiative. We don't just talk about scale, right? We do scale, we do Aadhaar, we do Diksha. 5 years is completely doable. The SDG goals are 10 years away, they're completely doable, and we have to commit to doing them. We may not achieve it, but we have to start out saying we are going to hit these goals by 2030, and we're delighted to work with all of you in the years ahead on this. Just to conclude, I wanted to talk a little about COVID. Something that Dr. Nina Raina said about how many gains have been lost due to COVID and the setback of the SDG goals. All of that is true, and it's often very sad to see it in real time. But I do want to also look at the bright side here. I think we have a real opportunity. The second wave of COVID has made the whole country understand the importance of health system reform. Now I think every individual doctor will understand why people talk about QI. Is to finish the Q and the I and then be ready for a third wave of the pandemic. You have to do health system reform beforehand, right? Not only in a minute of crisis. So what the crisis has done, I think, is really emphasize the value of health system reform and emphasize the value of QI to every stakeholder in the system, every stakeholder in Samaj, every stakeholder in Bazaar, and every stakeholder in Sarkar. So I think there's a real opportunity here in the next 5 to 10 years to make transformative levels of quality improvement in healthcare in India. So let's not let it lapse. Let's not see the COVID as such a setback or feel that the SDG goals aren't possible. Let's instead look at COVID as a catalyst, which unleashed a revolution in methods of how do you do QI at scale? How do you use digital means? How do you use innovative and fresh ways of thinking? They say that, necessity is the mother of invention. And that's kind of, I think, what has happened with COVID. I think we should see this crisis as an opportunity which has enabled true health system reform across India. Thank you.
Thank you so much, Dr. Janhavi ma'am, for sharing those enlightening words. And for